Intel, IBM, SAP, LinkedIn, Microsoft, and many more.
Now I would like to talk about the Women in Big Data India chapter. So firstly, talking about our leaders and our directors, Dr. Ekta Mehul and Ms. Soumya Moni. So Dr. Ekta Mehul is the director and CEO of Arena Solutions Private Limited. She is a technopreneur and an educationist. She has a career of 25 years, which is in industry and academia. She has been awarded as the Women Entrepreneur of Gujarat and has been invited by US for representing India in Women in Technology. She is working as a subject matter expert and master trainer for ESSCI and NASCOM with NSTC and professional bodies as the executive member for Computer Society of India, the Baroda chapter. Ms. Soumya Moni is the director of Inter Technologies. She is a data enthusiast and she is here with us today. She has 22 years of experience in technology marketing with an expertise in go-to-market strategy, product, services, solutions, portfolio, industry, deal, account-based marketing, market research, and influencer relations with HP, Oracle, Unisys, and Educom Solutions. She is an official member of the Forbes Communications Council and National Marketing Council. She is the most influential global marketing leader recognition from World Marketing Congress.
Coming to our WIBD India Executive Council team, we have Piyush Sharma, who is executive in residence at UCLA and Stanford Seed Consultant. He's a global CEO, coach, and a C-suite plus startup advisor. We have Dr. Abhilasha Vyas, who is currently serving as Executive Council member for WIBD India chapter. She brings 19 years of technology education and training experience in information technology. Ms. Sridevi Murugayan has 17 plus years of IT experience and is a passionate developer and problem solver. We have Dr. Bindu Narayan, who is a data sciences professional with 20 plus years of experience. And then we have Dr. Sudhindra Kaushik, who is Innovation Director at Volvo Group India and VP IEEE Technology and Engineering Management Society. Our very own Dr. Jasdeep Kaur Dhanoha, who is a professor in the Government Women Technical University of NCT of Delhi. She is Training and Placement Officer, experience of Head of the Department, PI of Government Projects. She brings 20 years of technology management experience from academia. And then we have Ms. Meenakshi Arun, who has 18 plus years of experience in software development, education, and analytics. She is currently serving as a Director of Data and Analytics at Microsoft India.
Now, I would like to talk about the Women in Big Data programs. So Women in Big Data India has 5 anchor programs, namely Vidya, Saraswati, Shakti, Gayatri, and Lakshmi. Now, talking about each of these in brief. So the Vidya pillar aims to disseminate knowledge to bridge the divide between industry and academia. It does so by conducting regular events with leaders from industry, government, and educational institutions. The Saraswati program focuses on curriculum design and development with leading practitioners from industry and academia. Shakti program targets women who are looking to restart their career and education. The Gayatri program partners with industry associations and corporates for development and education and execution of programs in developing women leaders. The Lakshmi Pillar acts as a job fair for employers to provide internship and full-time employment opportunities to women. Now, talking about the Women in Big Data India academia partners. So there we have Indira Gandhi Delhi Technical University for Women, Christ University, GSFC University, and RYMC University. In our industry partners, we have Infinitics, Inkture, Verena, Amplify Analytics, and many more. Now, I would like to ask Pavani to introduce our speaker for the day, Ms. Madhushruthi Roy.
Thank you, Anubhuti and the team. Let me take privilege to introduce today's speaker, Ms. Madhushruthi Roy. Can you please make me a host so that I can share a screen?
I've made you the host.
Yeah, thank you. Good evening once again, a warm welcome. So today's speaker is Miss Madhushruthi Roy, who is currently working as a director at Global Net Revenue Management at Novartis and a global healthcare company that provides solutions to address the evolving needs of the patients worldwide. And she has a total of 17 plus years of experience in consumer industry, driving growth strategy using big data. And she has been using data currently to derive the business decisions, and she's passionate about the data growth and sustainability. She's also a mentor for the Cherry Blair Foundation for Women, and her work experience includes analyst as Sky IQ, customer intelligence services, project manager at HP, consultant at a GE, Capital International Services. She has worked as a senior strategy manager for skincare as well as global hair care in Unilever, and also a senior strategy consultant at Deloitee. This is all in short about her. And ma'am, over to you. Thank you.
Thank you, Pavni. Thank you for the introduction. Shall I start or do we have any? Can I start?
Yes, ma'am, definitely.
Okay, so hello everyone. I see about 97 participants, which is good. Which is also a little I'm a little nervous now. So many people. I do justice to what I want to do today. So what am I going to do today is I will talk for the next 30 minutes or so. Can you guys see my screen? Yeah.
Yes,
Yes,
ma'am.
Yes, ma'am, it's visible.
So for next 30 minutes or so, I will talk about, I'll try and give you a flavor of how data is being used in the healthcare industry. Okay. This is a huge topic, to be honest. This is a huge topic, and I'll talk about it as how in this industry, it's pretty interesting because starting from simple data analysis to AI, very sophisticated AI, I mean, genome sequencing, understanding genetics, to that level, data, AI, etc. is being used. But I'll try and give a flavor of what is happening in the industry. Yeah. In the next 30 minutes, I have split the session into these buckets. So I'll talk about the objectives. So what can you expect from the session? Then I'll talk about data analytics in healthcare industry. I'll show you a few selected case studies, and then I'll open for question answers. Okay. So what is the objective and what is the scope? Okay. So as I already said, my idea here is, my mandate here is to provide a flavor of how data is being used in healthcare industry. Okay. It will cover application of data and analytics, but it will not cover full methodology and statistical process, because every case study maybe will take about an hour or more if I need to get into methodology. So I'm not going to get there, but I'll give you a flavor of what is happening and what is being done. Okay, so this is the objective of the session today. Now, before I get into analytics in healthcare or anything in any industry, basically, what is data? Very simply, so what is data? So data is nothing but information. Yeah. What does data do? What does information do? Information enables optimal decision. It is as simple as that. All that we are talking about, data, analytics, cognitive, AI, technology. If my 6-year-old daughter asked me, Mommy, what is data and what does it do? So this is what it is. Data is information. Data enables optimal decision. Yeah. Now, data is actually a recent phenomenon. Data is not something, this whole data analytics and the science of using data to take decision is a recent phenomenon, maybe 25, 30 years old. Yeah. Prior to that, business decisions were taken mainly on gut feel, mainly on understanding the real world, observation of real world. And to be fair to the business, then they've done a great job. So if you look at the top 500, Fortune 500 companies, all were formed about 100 years ago, except maybe the Facebook and the Apples, etc. And they have done a tremendous job. Yeah. But what happened is that when So when did this whole data thinking, yeah? So there were always information. We were always selling things. We were always treating patients. We were doing everything. But there came a point when the multinational corporations or these big businesses started having the capacity to store the data. Okay, that's when it started. However, this difference came when they started analyzing the data to take business decisions. And when they started analyzing the data to create insights and create business decisions out of it, they saw what a big differentiator it can be. Yeah. And that is where data became the engine of growth, or they call it now the new fuel. Yeah. It is a new oil. This is the engine of growth. So when every firm, every multinational corporation saw that this is a differentiator, everybody plunged into it and started harnessing data. Yeah, and most of the industries started using it, and one of the first industries to use it was financial industries, and that's mainly because they had the privilege of the data. So because if you have to have data, and consumer goods industry was towards the later part because we did not have that kind of data. And healthcare, what I'll talk about today, there was somewhere in between where healthcare started using data for various reasons. Okay, so that is a brief history of what happened in data. And now let's talk about data analytics in healthcare. Okay, so as I said that about 20-25 years ago, the healthcare industry started using data. Okay, so I will talk about the usage of data. So there are 4 key usage of data in in healthcare, and we actually started from the business side of it. So I'll come to that. So, but here what I'm trying to say is that the role of data analytics and healthcare became more and more important, and most of the pharmaceutical or healthcare firms have started using data to take various decisions. Okay, now the best part about the data in healthcare is that so I am in this industry for about 8 to 9 months now. Prior to that, I was in consumer goods industry where I have used data a lot, yeah. And now I'm using again data for a lot of business decision. But the biggest impact that you can create in the healthcare industry is that without being a doctor, you can save life. Yeah, so that is, I think, the biggest appeal of using data in the healthcare industry. Yeah, you can actually start influencing or impacting people's life through data, and that's what I'm going to show, that how we can do that. Okay, so what are the different types of data that you get in the healthcare industry? So like as I was talking, that we have started engaging with data and we started storing data. So these are some of the key data sources, like the electronic health record. Okay, now again, we know that the developed countries are more into digital, and they have a lot of data. So if you look at UK or the US or Singapore, or most of Europe, entire patient information is actually now digital. Yeah, which might not be in some of the developing economies, but we are getting there. So electronic health record is a huge source of data to understand people and the diseases and the causes and the benefits of medicine. Okay, and innovation and drug discovery data, patient sensor data, clinical trials, genomic sequencing, patient demographic, racial genetics data, etc. So these are some of the key data sources in the healthcare industry that is used to do data analytics. Okay, so with this kind of data, where do we use the analytics? What are the key focus of analytics in a healthcare industry? The usage of data in healthcare industry can be simplified into 4 key buckets. Okay, one is you do it for patients. Okay, I'll give you some examples on that. Then the next is drugs. So you drug discovery. medicines. Okay. The third is innovation. Drugs and innovation are quite linked to some extent. And then the fourth one is business. Okay, businesses, when you are actually talking about growth and profitability in a business, in a healthcare business. So this is where you have the maximum overlap with any other industry like a banking or financial or consumer goods. And these are the unique proposition of healthcare. And this is where the impact is quite noble, I have to say. Yeah, and quite humbling, to be honest. So let's see some of the case studies in healthcare. So let's start with my favorite one is drug discovery. So drug discovery is innovating a new medicine. Okay, so the whole R&D behind innovating a new medicine. Now, if you look at the pharma process, this is not vaccine, I'm not coming to vaccine, this is a typical pill. Let's just say maybe a paracetamol, as simple as that, yeah? From a paracetamol to like very, very complicated diseases, from cancer to and beyond, yeah? So it takes about average 10 to 12 years to develop one medicine. Okay, 10 to 12 years is a long time. It could be somebody's lifetime from the person getting the disease until he actually, maybe, he actually gives in to that disease and does not get recovered at all. So 10 to 12 years is a long time. And there are these are the key processes of an R&D process in a healthcare industry. So you start with an early drug discovery. So there is you have a target, you want to build a molecule or you want to build a medicine, which is a combination of different compounds for one particular disease. Yeah? So it starts with about 5 to 10,000 candidates. Sorry, there's a spelling mistake. So 5 to 10,000 candidates. So there will be about 5,000 to 10,000 molecules or compounds that are eligible to actually cure a particular disease. Okay, this early drug discovery takes about 4.5 years, 4 to 5 years. Okay, then we do preclinical studies. Okay, before getting into clinical, we do a lot of preclinical studies. From that preclinical study, in that preclinical studies, from 5,000 to 10,000, you come to about 10 to 20 candidates. That's about 2 years. Then you do clinical development. That is where you actually go and you test it with your consumers, you test it on human, you test it, unfortunately, you still test it on animals. And there is a phase 1, phase 2, phase 3 that takes about 5 years. Okay, that brings you to about 1 to 2 medicine, 1 to 2 candidates. Now that goes for FDA review. So that is, all the markets or all the countries have a medical council. India will have a different medical council. US will have a different medical council. So the medical council will actually look into it and make sure that this is actually safe for human consumption. And then finally, you put it on the market and then post monitoring. You monitor whether it makes sense or not. So basically, this is a 10 to 12 years journey in a lab. Now, so what is data doing? So data is actually helping to bring this time by 50% or more, well, about 70 to 50%. There are some labs. Now, we can see that the COVID vaccination is an extreme case, which we got it in like a year. And some of the I don't want to get into the complexities of what kind of tests were done, etc. But that's a special case of getting something in 1 year. But in a general case, this 12 years is getting merged into about 5 to 7 years using data. So what is it that we are doing? So in terms of, like, suppose early drug discovery, there's a lot of so these molecules or the compounds that we use, this gets examined for various diseases. Okay, so maybe you have molecule A, B, C, D, E. That can be, maybe some lab has used it to treat cancer. Okay, now you want to go and treat TB. I'm just giving you an example. Now out of that, and you are using A, B, C, D, E, F, G, H. what happened is now, because data can be stored and data is already there, you have all the information from A to E. You have to do only maybe FGH at this point of time. You only have to test FGH. Okay. So basically what's happening is that you can use a lot of past information. You can use a lot of past medical trials to get into this whole innovation process, which is actually lowering your time significantly. And another thing that can be done is a lot of simulations can be done. So you can, like in a preclinical study or a clinical development, when you are using actual human beings or animals, what you don't have to now go and do it on 10,000, 20,000, 30,000 people and across the board, different ethnicity, different race, gender, because people's different genetic has different impact from medicine. So now what we are doing is that because this information is now already there, so most of this information can be used and most of this information can be statistically simulated. Yeah. So basically this time is actually getting merged to half of what it is. Yeah. And this is a huge impact on the healthcare industry. So that what I'm trying to say is that you don't have to now wait 10 to 12 years. And the 10 to 12 years, the problem also what happens is like, now we all know about it, like in the COVID, you see that a virus, it gets mutated, right? It's not the same virus strain, new strain is coming. So even with diseases, the disease gets mutated. So maybe on the 6th year or 7th year, you see that what you started has now mutated to something else. So then you need to start again. Yeah. So basically what's happening that with this whole usage of data, so through large scale simulation, using patient information, analyzing the results of conducted tests at scale, cross-analyzing results from scientific papers, assessing market potential, using data to conduct post-monitoring of results. So basically doing this entire big data analytics, your whole process of research and development can be halved. And this is, as I already said, is a huge impact on the healthcare industry. Okay, so this is like number one that I believe is where you can make a difference by coming into the industry, by exploring the industry, and by getting into this piece. Yeah, so data in research and development is one of the key core usage of analytics in this industry. Okay, so that's a case study one. I mean, all of this are highly complicated and complex statistical procedures, simulations at a different level, etc. So I don't want to get into this, but I'm just giving you an idea that using data, the whole process can be halved. Yeah, so you understand the impact that you can create using data. So that's number one. Number two is another piece, which is drug shortage. Okay, so now if you look at drug shortage, so for a simple example, if I can say that maybe you have a headache today, or any other, maybe a simple, you have an illness, and we have heard so many times that I went to 5 pharmacies and I did not get the medicine. Yeah, so but that is okay if you have like a cold and fever and you can use some homemade remedy. Imagine it's a life-threatening disease, yeah, and you need to maybe administer a dosage to a patient maybe in 24 hours, and the drug is not available in the market. Okay, so that is a big issue. That's a big issue for the healthcare industry. So especially in Novartis, our motto is access of medicine to everyone. Yeah, so drug shortage is taken extremely seriously. So I lead 3 pieces of work. One is drug shortage, one is revenue management, and one is tender pricing. So drug shortage is one of the pieces that I work on, my team works on. So what we are now trying to, so basically what is the problem statement? Problem statement is that there is a drug shortage, or sometimes there is overstocking. And overstocking is, again, the problem of stocking it leads to inefficiency, it leads to extra cost. But then more than overstocking, the problem is of the shortage. So if you look at from a human perspective, that there is no drugs available because we could not foresee the demand. Yeah. So what we are trying to do is use time series data forecasting. Yeah. So we did a piece of work in the UK with the NHS, which is the National Health Services there, and we were able to actually forecast the demand for three key molecules quite accurately, which again, of course, helped the patients, but also helped a lot around revenue growth for the company. So this is another piece on which data is used, and this is the whole supply chain optimization. Actually, it is not just drug shortage or overstocking; it's a full supply chain management, which now we are now from this. We've done our first piece of work on data shortage. Now we are going for overstocking, and then we are now planning to do a full supply chain management through data. So the gains are that timely access to medicine by patient, which is the key objective. And number two is that you eliminate inefficiencies of storing something which is not needed and not storing something that is needed, which actually leads to revenue gain. Yeah. So this is a win-win for patients as well as the business. So this is another way how data can be used to amplify or to enhance access of medicine to patients. Okay, so this is case study number 2. Then another case that I want to talk about, this is on business. Okay, something that I'm leading is the optimizing discounts. So this case study is from a business point of view. Okay, so what happens in a pharma industry mostly? So you are a manufacturer of medicine, so you either sell it to the wholesaler or you sell it to the pharmacy directly. Okay, now when you sell to the wholesaler or to the pharmacy, let's take examples. There are 3,000 pharmacists in your country and you are selling it to all of them directly. Okay, now you sell it at a price, so there is a gross price. Okay, so you sell maybe 4 rupees for 1,000 pills, just to give an example. That makes it 4,000 rupees, just to give an example. Now what happens is that is where you start with. That's where your theoretically there is a price called 4 rupees, which gives you 4,000. Now what happened in the pharmaceutical industry, there's a lot of discounts that goes. Okay, there's the trade of terms, which we call the trade terms. In the trade terms, there are a lot of discount. There are multiple discounts that we provide to a wholesaler or a pharmacy, okay, for various reasons. Now in the pharma world or the healthcare world, these discounts can be split into 2 parts. One is called touchable, one is called non-touchable. So non-touchable are mandatory discounts. Because it is a healthcare industry, it is a highly regulated industry. And in this industry, the key idea or the key purpose is access to medicine. So there are some discounts that the government has mandated for the industry. So maybe there is this 800 rupees, which is mandatory. You cannot touch it. You have to give that 800 rupees to your pharmacy. But this 750 plus 1600, so 2350, this is actually not mandatory. This is a contract between the manufacturer and the pharmacy. Okay, now at one point of time, so what happens is that when you give this whole you give this entire discount, you're actually left with 850, right? And from this 850, you have your costs, you have your cost of goods, so you are actually left with only that much of your gross margin from 4,000. This is an extreme example, but most of the time you are left with only 35 to 40% of the gross sales, or less than that. Okay, so at one point of time, because this transparency was not there, we knew at a market level or at a country level that, okay, we are giving 30% discount, something like that. Yeah, so we just played at a macro level. Now what's happening is that for each pharmacy, for each wholesaler, big data is enabling you to see this transparency. So you can have your 3,000, 4,000, 10,000 pharmacies and see, okay, this is my discount. This is the percentage of discount, and this is the final gross margin I'm getting, and this is the growth this pharmacy is giving me. So once you have this story in front of you, you can actually optimize. Do I really need to give 1600 to this particular pharmacy? Is it giving me what it is supposed to give? So there are, I mean, this kind of discounts are based on a lot of efficiency terms. Sometimes they will tell you that, okay, I will do this, or there's some of the conditions that the pharmacist put that I will follow these conditions because of which I need this discount. But once you have this transparency, you actually get to know that whether this kind of efficiencies are actually met, and whether it is worth paying this 1600 to this particular pharmacy or not, or should I actually reallocate this 1600 to another pharmacy where I'm paying less but I'm getting more. Okay, so this is a very powerful, this is called the final lever of revenue management. So if you look at revenue management, it has starts from pricing to back price architecture to promotions to trade terms. And trade terms is a very powerful tool by which you can actually optimize or maximize your profitability and growth. Okay, and big data has actually revolutionized this whole revenue management process, not only in healthcare but in all industries, especially in consumer industries. But now healthcare industry has brought it up, has actually is using it, like GSK, Pfizer, etc., are using it aggressively to understand where their investment is going, how to reallocate this investment, and actually and maximize profitability and growth. So this is another example where big data can be used for the benefit of the business. Okay, so this is a business related example. So these are the three key examples that I wanted to talk about. I talked to you about drug discovery, I talked to you about drug shortage, and then I'm talking from a business point of view. Okay, I know it gets overwhelming, so I'm not getting into too many case studies, but I'll just stop. And before stopping, I'll just give you this spectrum that I wanted to talk about, which is which I already I touched upon, is that the whole spectrum of work that is happening in this healthcare industry. So starting from a simple data analysis like pricing analysis, to statistical modeling where you can do consumer segmentation, demand forecasting, supply chain optimization, simulation, to sophisticated AI technology, etc., where you are doing maybe genome sequencing. You're trying to understand genes of people. So they are saying that cancer is going to be a history. Maybe one fine day AIDS will be history, because we will just understand what that gene is and how to modify it, maybe in a mother's womb. That is the kind of work, that is the kind of the artificial intelligence work that is happening. That is the kind of work that is using data. So some of them are fascinating. I couldn't bring the example here because of confidentiality reason, but trust me, I mean, there now we have a medicine. We have a medicine where if there is a baby, if there's a baby whose spinal cord is not developed. So there are some babies who are born without a spinal, I mean, there is a spinal cord, but it's not developed. Okay. Now, Zolexma is the name of that medicine. Entire research was done on data. I couldn't bring all these examples here to show what they do, but yes, entire piece was done on data to try and understand the baby's gene, starting from the mom and the dad's gene, and how it relates to various other circumstances, different circumstances of different kind of people. And now there is actually this medicine, which is an injection. It costs about 1.4 crore in India. It's a very, very expensive medicine. There is a baby who got it a couple of months ago, and government of India helped them. Novartis has supplied the medicine, but that was a fascinating example of how data, technology, AI was actually used to cure something like that, which was impossible to even think maybe 10 or 15 years ago. And then the kind of work that is happening in cancer, the treatment kind of for AIDS, for blindness, the blindness on birth will blow your mind, and how they are using analytics, how they're using data, how they're using so much simulation. So I'm just trying to give you an example of what is being done at that level. And then of course you have this, which is where you find a lot of overlap in financial industry, consumer goods, etc. So basically trying to tell you that this is a fascinating world. Without being a doctor, you can save life by being in a computer, doing some simulation, doing some data analysis. You can help patient, you can help in innovation, drug discovery, and the business. I personally feel very privileged to be in this industry using data. And I just wanted to give you a flavor of what has happened. I think I've spoken a lot. I will now stop and I will open this forum for question answers.
Fascinating, and so succinctly provided the three use cases that we can all relate to. Thank you so much. I was fascinated by the genome sequencing, and I have a personal story to share around how data impacted my life. My mother was detected with breast cancer, early stage actually. So, there is this genome sequencing which allows you to see whether you have those cells in your body, as carrying, whether I am the carrier of that gene or not. And that was done through data. So there is a technology, or rather there is a study, or how do I say, it's called MammaPrint, like the way you take prints, right? X-rays. That's called MammaPrint. Now that MammaPrint actually gives you, and this is all simulation based on data, as you know, whether predictability of the cancer being infiltrating the body, other cells as well, or can that be contained? And that was done through data. So I've got some real life experience of, looking at data and seeing how data, and so rightly summed up, Madhushruthi, without being a doctor, you can use data effectively. If it's used ethically, you can use this well to save lives. So, or improve patients' lives actually. So thank you so much. I loved the session. Over to the students. Yeah.
I request students to ask any questions if you have. Okay, some questions I have got. So, ma'am, you have told that you can make use of data without being doctor also you can get curative. But how much efficient is that? Because in recent days, the great player Nadal has a serious injury and he couldn't. The doctor said based on the data obtained on his health, he couldn't play and he is not in a state to move much. But still, he had made a great progress and he had won the slam. So what about that, ma'am? How much efficient is the data which can make a progress?
So are we saying that how Nadal did it even when the medical science said that he cannot do it? Is that what we're saying?
Yeah, ma'am. In short, yeah.
I mean, Nadal is a superhuman. There's always something called that is always something called mental strength, and there is data around that. There's some people who have that mental strength, who have that physical strength to overcome few things which are beyond a normal human being's understanding. This does not negate anything that the data says. Says nothing against that the data. I mean, these are two different questions actually. I mean, data analysis and your past information can say that this, if this happens, this is the cure for this. And somebody might say that, okay, in 10,000 or maybe millions of cases, we have seen that if this is the condition, the human being needs to take rest. There will always be an exception, and that does not negate data from any angle. These are two different questions.
Yeah, thank you, ma'am. And even I got some other questions, like some of them have asked, like with a growing number of like portable devices, such as we have smartwatches, oximeters, etc., which allow patients to check their vitals, such as oxygen levels or heart rate at home on their own. Like, is accuracy and misdiagnosis can cause a concern?
Yeah. So as Soumya said, right? So ethical use of data and right use of data. So that's for everything, not only a medical apparatus, anything. I mean, your TV or anything. If you don't use it properly, it can lead to harm. Okay. But what's happening is that technology is advancing to such a great extent that the margin of errors are actually going down and down and down. Okay, and this is actually a consequence or contribution of data, because as I said, simulation. At one point of time, I don't know if maybe you guys were not even born there, that when you watch TV, you can't watch TV properly. After a point of time, the TV is like blurred, you know. Now that never happens. You know, whenever you are watching TV, OTT, whatever, you know, on your phone, you can watch all the Netflix shows. There's no disturbance at all. Technology has improved. How has technology improved? Technology has improved because somebody realized that there is a problem and we need to solve it. Yeah. How did you know that there is a problem? You had that information, you use that information to solve the problem. So yes, when you use an oximeter, when you do self-diagnosis, there could be a margin of error, but technology has advanced so much that the margin of error is decreasing and data is contributing to that a lot. I mean, look at the smartwatches, how many times does it fail? Look at TV, how many times does it fail? So data is information. As I said, information, a huge amount of information is helping a lot in reducing the margin of error, and there will always be some, and that is what technology is doing. We are improving every day, and students like you will join the industry tomorrow, and you guys will aspire and you guys will do more, and so that the margin of error becomes zero. But again, does not negate anything from what data actually does for us.
Great, man, great. I would like to move to the next question, that like, given the fact that there are many new COVID-19 cases and they don't get entered into the official record, then doesn't further research or conclusion based on this data loses its credibility?
Very good question. Very good question. There will so this is not just a healthcare data issue. This is a issue with entire data industry, because some of it is always missed because the correct entry has not been done. You know, so if you start from olden days, people are doing their accounting by hand, you know, how much you buy, how much you sell, etc. So there is a danger. But if you look at the developed countries, at least most of it is recorded. Now I'll come to that. Okay, that's an interesting question. Now suppose a country in Africa, they are not recording. They're recording only 5 to 10% of it. Okay, Germany or UK Singapore is actually recording 100% of it. Yeah, so Africa can use some of the information there to actually simulate and say that if this happens, we can have this cure. So basically, if the data is available globally, maybe it's not available in Africa, but I can actually use the data in Europe. Now you can argue that the impact or response of an African ethnicity might be different from UK or from a Caucasian ethnicity. But then I'm just thinking aloud that there are people of African origin also in these countries. So I can pick up that data and use it and simulate it and have the cure here. Yeah. So basically what I'm trying to say is that there will always be some loss, but with what is happening and the kind of recordings that are happening, the entries that are happening, it is possible to simulate even if it is not locally available. And there are thousands of cases that you can actually bring to life on that. Yeah, so this is like, if I don't have the data in Africa, I will use the African population in UK to try and simulate, and that's how data is helping you. Yeah.
Great. Yeah, I would like to ask some other questions which I've got. Like, nowadays mental health is of big matter because of COVID, most of the lockdown has happened, and even people have turned introverts more. So, like, as mental health is gaining the legitimate and deserving attention, though a bit slowly, what is the future of data analysis or AI in this field?
I mean, so the more and more people come up and say that you have a disease, like somebody or maybe the entire population one fine day stood up and said that I have a cough and a cold, and then a paracetamol was discovered, right? So as you say that more and more people, when they come and say and talk about it, and doctors start to analyze why, because if I come and tell the doctor I'm feeling depressed, they'll ask me why. So they will start having this information on what are the root causes, and that information is already there and people are working on it. Yeah. So and the best part now, what you already said, is that it is gaining traction, people are opening up, that is giving us more and more data, more and more information, and I think that will help, that information will enable optimal decision. And going back to what I said in the beginning, that data is information that will help in a take good optimal decision. As we know more and more about mental health, which is still maybe 20% or 30%, more and more, maybe there'll be genetic study that will happen. Maybe somebody will say that, if you come from this ethnicity, or if you're from this kind of circumstance or this kind of parenting, you will have it more or less. And then maybe we'll be able to actually address it very maybe at a school level. So I see a huge benefit of data there. And when people are opening up, and the health and well-being industry is booming, I mean, the kind of vitamins that we see, all that is happening is already there. But the true causes will be enabled by data, more and more information. And as I said, I'm expecting that 20 years down the line we will be able to address it. Like we give up, vaccination, maybe we will treat it at a very young age, proactively, and that will be enabled by information and data. So that is the hope, actually. Yeah.
Mm, yeah, ma'am, that's great. Thank you. And now we have one more question here. Like, when encountered with symptoms, we all generally tend to turn into Google and find answers to our queries, and reaching wrong conclusions and taking wrong medications are highly risky in this case. So, and availability of online consultation with the doctor has got limits or has no better reach yet. So, what are the ways in which people can make informed decisions, or how AI can detect, help these diseases?
Good question. So, yes, so we all Google, right? I mean, like COVID time, even if there's a little bit of sickness, we used to feel like the symptoms of COVID, and all of us thought we got COVID. So that happens, yeah. But that is wrong. But the point is that when it is something like a health, you need to take informed decision. The question is how will we get there? So there is also a lot of legitimate information. This is not a very data question, but let me just tell you, a lot of legitimate information. So if you look at, I'm referring to UK a lot because the healthcare system is extremely developed there. So if you go to nhs.org, type anything. Okay, there you will get a lot of information as to what it is, what is the kind of medicine you should, when should you see the doctor, etc. And this is actually all based on research and data. Okay, so you have to know where to find the information, the right information. And in terms of AI, so AI is also, I mean, how can AI help you take a right decision? Is, again, I mean, AI maybe will come to maybe there'll be an app one day where you open it and you show yourself, and then maybe they will be able to say that whether it is just a cold and fever, or is it COVID, or is it some serious disease, right? But at the end of the day, you have to know which app is that. So there's some there is information chaos in the world today. So very important that students like you at your age, you absolutely know what is the right source of information. And when you go to the right source of information, you will get the right source of right responses. And and these right responses are actually based on data. So AI will be able to look at your eyes and say that this is COVID. That means somebody has done some algorithm saying that if this is how the eyes look, then actually it is COVID, otherwise it is cold and fever, or otherwise it is something. Data will play a huge role, but I encourage all of you to go to the right places and the right apps.
Thank you, ma'am. Thank you so much. And like, even I have got another question with that. Like, with more focus on lifestyle changes, what role can data analyst play for any individual? Like, for example, for better diet, a calorie intake calculating device at one's disposal can be quite helpful. And though one step ahead would mean that the type of food locally available according to the seasons is detected and best for the individual is tracked and reported.
So what's the question? That how can data help self-quantify and self-understand this?
Ma'am, what is the role of a data analyst for any individual with the changing lifestyles?
Okay, so the thing is, I mean, what will a data analyst do? The data analyst will get more and more information about if you sleep. Who told that if you sleep 8 hours, that's an optimal sleep? You guys have an Aura ring. I had an Aura ring. I'm not wearing it actually. That Aura ring tells me that I should sleep 6 hours or I should sleep 7 hours. How did we know that? Some data analyst has seen that somebody with my lifestyle, maybe waking up at 5:30, doing this much exercise or not doing any exercise, or eating this or not eating this, or using this much of mental stress, should at least sleep 6 hours. So that is the role of the data analyst. The data analyst has done the analysis, has looked at the information, and has told you that yes, you should go and sleep for 6 hours. Some data analyst has seen and figured out that rather than using all the fancy vitamins, just go and have a banana, and that would actually help. Some data analysts have figured out that for that local food, that what you talked about, the local food is an extremely important source of health. And why? And also because if you look at genetically, we are all different, right? So what works in Singapore doesn't work in England because of the weather. So somebody must have looked at the information and said that if you are in this kind of weather, this is what you should eat. If you're in that kind of weather, this is what you should eat, and that's local food. Yeah. So that is the role of the role of a data analyst in every field, starting from healthcare to medicine to well-being to consumer goods to everything, is to analyze the information and give the right response to that. Okay, so the role of a data analyst is to understand the root cause and give a response to that based on historical information.
Thank you, ma'am. This was actually quite interesting and insightful. And thank you for the entire session, as well as all the answers to the questions. I would like to request all the participants, like whoever wants to switch on their videos. So we could just take a team picture for that. And Madhushruthi ma'am, if you could just stop sharing the screen.
Sure. Okay.
Thank you, ma'am. I would also like to request the participants to fill in the feedback form.
You don't see too many people, right? Only 4 or 5 of us.
People generally don't switch on their cameras, but thank you to all who have switched them on.
Thank you so much. Soumya, you are on mute.
Yeah, let's get on the gallery view and let's ask everyone to switch on their cameras if you can. Let's see all the lovely
faces. All of you. Yeah, I mean, lovely questions. I mean, yeah, very interesting, very intriguing.
And Pavani, thank you for curating those questions on behalf of the audience. I think it was such a great it gave me some great sense of how much thought has been put in those questions.
Yes. So, some of them were tough questions, I have to say. But yes, no, because it was great, and I encourage all of you to come and explore the data analytics industry. It's yeah.
If you have any more questions which have remained unanswered, please do send that over. We will send that to Madhushruthi separately. But and we'll make sure that, they get answered in one form or the other. Okay, so I think, I guess we've got the audience that we need who are not camera shy, and let's get them on.
Yes, ma'am. I've been taking screenshots as and when people are switching on their camera.
Good, good. Okay. Thank you. Thank you, Madhushruthi. What a wonderful session it was. And thank you, Pavani. Thank you, Anubhuti, and, Khushbu for hosting it today. Thank you for the entire team, for coming together, and Dr. Jasdeep and Dr. Anuradha and Dr. Lija, Dr. Samiksha, all our university partners, for coming together and helping us sort of, do our bit in spreading awareness on data and the usage and application of data across industries. So thank you.
Thank you, ma'am.
Thank you so much. It's been a privilege. Thank you so much. Speak soon. Bye, guys. Bye.
Thank you, ma'am.
Thank you.
Thank you, ma'am.
Thank you to all the participants for joining. You can stay in touch with us with the links provided in the chat box, and please do fill the feedback form. Thank you so much for joining, everyone.
Thank you. Bye-bye.